Hey everyone, my name is Ahmed, and for today's video we're going to dive into something that a lot of people ask me in my life. Why I chose to become a nurse rather pursuing a career as a doctor. A little backstory, let's go, a little backstory. When I was in high school, senior year, I did a lot of research on healthcare careers and which area would be smart to go into because I think healthcare is a reliable area. If you look at the climate today, the economy has been low, causing a spike in people getting laid off, and I did not want that for myself. I did not want to have a career where I'm scared of the economy shifting, causing me to be able to get laid off. I wanted somewhere that would be stable, which is healthcare, and that's why I did research on those topics. I won't go into depth on which college degree you should get into. Maybe I should do another video on that because I do have some opinions on that and what would be beneficial on making your return back. I looked at every area of healthcare and it went down to two: a nurse or a doctor. I'm going to be honest, both paths had their appeal, but after careful thought, I realized that nursing is a better fit for me, and I wanted to share the reasons why. I chose to become a nurse my senior year of high school, and I was set on that. I knew I was going to go to this school becoming a nurse. Dead set on that. But people's opinions and stereotypes on me being a male and pursuing a nursing career, which is predominantly a female career, which is true, even though I work with a lot of males and it seems equal. Not equal, but I would say probably 30% males I work with currently in the workforce now. So all that stereotypes and opinions caused me to change my major, in which I declared in college. So I think I changed that probably the summer before going to college, and I changed it to pre-med. And I did pre-med for a year. I thought when I got into college, I should challenge myself. And I wanted to challenge myself with a healthcare degree because it's not easy to get a healthcare degree. So it was either pre-med, which I tried, and I just knew by the research I did in high school, I was set on it. And I felt I shouldn't allow others to make me change what I think is right for me, right? So I just went back. I declared my major to nursing my sophomore year of college. Set me back a semester graduating. So I graduated the winter of 2024, which is probably a year from now. It is a year. It just became a year. And 2023, that spring, I was supposed to graduate, but I didn't choose to stay with pre-med. So let's get into the reasons why I chose to become a nurse rather becoming a doctor. The first reason is that nursing is so broad. The spectrum of nursing is so broad. I can use my nursing degree in so many different ways, from different floors like the ED or emergency floor or ICU to cardiac renal, to psych, to even travel nursing, right? Or just leave bedside nursing aside, maybe cosmetic nursing like injections for Botox, or doing sales, a sales rep. It's so broad, and that's why I enjoyed about researching nursing and the career it can give me. And that's really unique. But if you become a doctor, that is just not what you can do. You specialize in one area, and for that specializing, you might hate it. And I've done research, and it shows that like a lot of doctors do have job satisfaction that is super low. The percentage of people who actually enjoy their job is super low. And this is a simple fact: if I didn't like an area of nursing, guess what? I can go somewhere else without going back to school and specializing in a whole different area of medicine. That's extremely important to me. I didn't want to have a huge mistake over my head that would ruin me enjoying my job. The second reason is work-life balance. While nursing is still demanding, it offers you more flexibility in a way that, I need to stop talking with my hands, sorry for that. I'm gonna try to keep my hands down, but in terms of scheduling, it's so flexible. I do 12-hour night shifts and I only really work 10 times a month. Out of 30 days, I only work 10. Or usually there's some months that are shorter and some months that are longer, but in the average, a month I work 10 days, right? That's not likely for me becoming a doctor. Huge periods in between those weeks where I have breaks, and which allows me to have several days off in between where I can go see friends, travel, which is important to me because when I was younger, I wasn't able to travel, and that is something I want to do. And this job or this career allows me to have time to do that and gives me enough money to be able to do it often. Now, as a doctor, your schedule is not flexible. You have to be a resident and be in your residency, and you have to average around 100, I think I remember 100 hours. I think it has to be a little lower now due to them fixing that, because I don't know who can do it 100 hours a week. I can't do that. I don't know if you could, but I can't spend that much time working and not really having a life. Not saying doctors don't have a life, it's just something they sacrifice for, something they really love and enjoy to do. But on top of that, not only do they do all these hours, they're salary based, which means they do overtime. They do not get paid. And that's something that I just can't fathom in my head. If you're taking time out of my life, and I say you, I say as a job. You're taking that time out of my life to do extra work. I want to get paid for it, and I think I would strictly be only hourly pay. I don't think I'll ever do a salary-based job. And a quote that I've heard from my fellow nurse that I work with is, "I work to live, not live to work." And that's something that's profound. What a profound quote, right? It's just basically meaning that you work so you can have a great life. You just don't want to have a life where your work consumes you. And that's what I think 100 hours a week will do to me. It will consume me. And the third reason is direct patient care. This is so important to me because I enjoy making connections with people. I enjoy meeting new people. I enjoy conversating with new people. And that's why I made a YouTube channel. I want to be able to express myself to a lot of people and interact and communicate with a lot of people as well, because I don't know, I don't want to get too spiritual or whatnot, but we will leave it at that I just really enjoy having true connection with people, and I get to do that every day. But we all know every encounter is not perfect when meeting a patient. Some patients do not want to have a connection with you, and it's very small, but you'll just have to deal with it. But majority of the people who come into the hospital really do want to get help and really enjoy that we are there to help them, and we're not judging them in any way, or we are very empathetic in the fact that we don't understand where you're going through, but we can try to understand, because you never really understand what anyone goes through in life, really. Also, what is a benefit of this job is this hands-on. I don't think I could survive being behind a desk and sitting in a chair and typing away. I think that's not stimulating enough for me, my mentals, for me to be able to do that day in and day out. So being hands-on and doing things and being active during work is what really helps me. No hate to people who do like that. You just have a different personality than me. I need to talk to people. But there is some times where I do have to be behind the desk, which is charting. A lot of people in healthcare do not like charting, but to be honest, we do chart a lot as nurses. But if I put my shoes in the doctors, I don't think I could chart as much volume as they do. It takes a lot of time out of the day to chart, and that is something I don't think I could ever really do, especially now working in the field and understanding how charting is. I don't know if I can do that, because the doctors usually have higher patient loads, and the fact that nurses are kind of capped in some areas of nursing, while doctors kind of have a higher patient load, and more patient load, more documentation and charting, and more hours, which I don't think I could do. So hats off to you guys who are doctors out there. I just can't do it. And it's something that I really do think that becoming a doctor, you have to have some grit, and you really do have to be inspired in some way in your life to want to become a doctor. So the flexibility and the ability to take time was definitely a key factor in my decision to pursue nursing. And keep in mind, it's fast paced, and every day does not look the same. And those days that are not the same, I'm learning so much more. It keeps you on your toes and helps those 12-hour days go a little bit faster. So that is my story of why I chose one over the other. It's really all about what suits you. I am incredibly proud of the choice I made for myself and the lifestyle I want. And I wouldn't change it for anything. If you are considering a career in healthcare, I would really encourage you to do some research on what type of lifestyle you want, and really choose that based on yourself and the path you feel will fulfill you in your future. Alright, thanks for watching this video, and I hope this video helped you understand why I chose nursing over becoming a doctor, and hopefully you can try to make it a little easier for you to choose in between those two. If you have any thoughts or questions, please drop it down in the comments. And if you want to see more, please like and subscribe. Alright, see ya.